Welcome to the PeakDay podcast, where we discuss fertility and natural family planning with our friends. Today's guests are Juliett and Andy Urban. Andy is an English teacher at a Catholic high school, and Juliett is the education coordinator at a crisis pregnancy center. Juliett was already charting her cycles before their engagement and shared NFP with Andy when they were engaged. They were married just over a year ago in 2003. They enjoy learning new things, going on hikes together, and spending time with family and friends. Welcome, Juliett and Andy, to the PeakDay podcast.
Thank you.
Thank you. It's great to be here.
Yeah, I'm very, very happy to have you. And thank you for being so eager and willing to talk about your fertility journey with us.
Absolutely.
Can you tell us a little bit about how you met?
Sure.
Yes. So we met originally through a young adult ministry at a Catholic church here in Orlando, and we hit it off pretty immediately. But at that point, I was kind of discerning whether I was called to marriage or perhaps called to religious life, and I had kind of made a resolution that I wasn't going to be dating for at that time, and so I didn't pursue it, and then eventually discerned that marriage was my vocation. And then we ran into each other again at a retreat sponsored by an organization called Young Catholic Professionals here in Orlando on the Feast of St. Joseph. And, we reconnected, and I asked her if she wanted to go out sometime, and it went from there.
Mm-hmm. Yeah.
That sounds providential.
Mm-hmm.
So let me ask you about your knowledge of natural family planning. I know, Juliett, you were already charting before engagement. How about you, Andy? Were you aware of the practice of natural family planning for married couples?
I was aware of what it is, but I didn't have any real knowledge of like the nuts and bolts of how you chart, how you determine, where you're at in your cycle, when your fertile days are, and all of that. I knew basically the concept of natural family planning, that it's, as Catholics, we don't believe in using artificial birth control. And, but yeah, I didn't know much about like how you actually determine when those times are.
Right. And how about you, Juliett? When did you learn about charting, and what brought that about?
Sure. Well, ever since I got my period, I've had very, very painful periods, and like debilitating, to the point where I would be vomiting a couple times on my first day, and I wouldn't be able to go to school or be able to go to work. And I would just be praying that I could get my period on the weekend so that I wouldn't have to miss school or work, depending on where I was in life. Mm-hmm. And unfortunately, every OBGYN that I saw was like, oh, we'll take birth control. Birth control is going to be able to regulate that, or just make sure you're taking enough naproxen. And that wasn't the answer to my problems. And when I was 28, I moved back to Florida from another state, and I somehow got in touch with Dr. John Hartman, who works in Kissimmee. And that was the first doctor to not tell me to take birth control. And who taught me that there's another way, and that it's called NFP, and it's charting, and it's getting blood work done at the right times of the month, and looking at your hormones and making sure that everything is where it's supposed to be. And he eventually retired, and then Dr. Pearl Huang, who also works side by side with him, became my doctor. And she kept along with what Dr. Hartman had already taught me. And it was life transforming. That's not an exaggeration. That's why I wanted to be here to talk about this, because it literally was life changing. Because little by little, the pain was going away. And not just because I was charting, but because we got to understand what was going on, which part of it was me being low on progesterone and maybe not eating the right food or not having enough of the right vitamins. And then just understanding more about my cycle, getting the right blood work done. And the progesterone really helped me. So that's why I originally started charting.
Mm-hmm. Mm-hmm. So then when you got engaged, you shared your fertility history with Andy, and what happened after that?
Well, when we got engaged, I shared with him more about NFP than when we were dating, because NFP is really when you're married. So
Right.
I think I told you a little bit more about it. Sometimes I would kind of tell him what was going on with my body, but really I believe that should be happening when you're married. So,
Sure.
We were waiting until marriage, so there was no need to really discuss too many details about what was happening within me, in my body. But I don't know, I guess we learned a little bit more about NFP at pre-Cana, but I think it was really when we got married that it was like, okay, now I can share my chart with you, because we didn't think it was appropriate during engagement, since there's no need for it, really.
Mm-hmm. So how important do you think it is, Juliett, for a young woman to learn about her fertility signs?
I think it's extremely important for a woman to learn about her fertility signs from the moment she gets her period, to understand what a normal cycle is, how long she should be bleeding, for her to understand that mucus is a normal thing, because I think some girls might get nervous that like there's something coming out of their bodies, and they might even be afraid to say something. But if they're taught that it's normal and it's actually a great sign of health, it might put them at ease. Right. And so I really think this needs to be taught to every girl, maybe even before you get your period, just so you know what's going to happen, when you hit puberty.
Sure. And you suffered for a long time before you started to get answers. You were 28. That is a long time to have those severe pain and symptoms.
Absolutely. Very long.
Yeah. Just imagine what, your younger years would have been like if you had been able to manage it with, better nutrition and more knowledge.
Absolutely.
Yeah, that's heartbreaking, because so many girls go through that, right? They deal with that, or else they are put on the pill, and it's just kind of a Band-Aid. And
exactly.
Then rip off the Band-Aid. It's all there, all over again. Still not solved, right?
Exactly. Yes.
Yeah. So, how does knowing about your fertility help you kind of maintain like optimal overall health, as well as fertility health?
I guess awareness is like the key word for me. Is like, I know where I am each day. I know where I am each week. And so I definitely know like I need to kind of exercise more before I'm going to get my period. So to me, it just helps me grow an understanding of my body, so then I can make the right decisions to take care of myself and be a better wife and daughter and coworker. So I would say that's how.
Right. Andy, are you like appreciative of the fact that she knows her body so well, and that she can take care of her overall health and her fertility health with fairly simple things?
Well, yes, and I didn't know Juliett before she had found effective ways to manage the painful periods. But from what she's told me, it was a horrible experience that she had to go through in her past, and I'm very, very thankful that she's found something that has worked for her to address this problem, because it it was a horrible thing that she had to, suffer.
So I'm sorry, Juliet, were you charting before you went to see Dr. Hartman?
No, I had never heard of it. And
Okay.
for
So
me, it's
when
very unfortunate that I didn't hear about it because I was in very like Catholic circles, if you want to put it that way. And I'm like, why didn't anybody talk to me about this? Until I was 28, like you said. And it's not like I was secular or, not practicing my faith, and no one ever talked to me about this. And
yeah,
it's so important to raise awareness
right,
about NFP.
right, yeah. So you it was recommended that you chart, and I guess you did some blood work, and then, so how important was your charting, having those charts in being able to kind of diagnose what was going on in your body?
It was important. First, I had to learn how to do it. And thankfully, Dr. Hartman's wife is official NFP instructor. And so I would be able to see her after work and show her my chart. And she would tell me if I was doing it correctly. And she would be able to guide me like, oh, this looks a little strange or whatnot. So I'm also so grateful for her, and that it was so easy to just call the office and schedule an appointment. It was late in the evening because she had to wait for me to get out of work, and she was willing to do it.
Oh.
And so what I think is so important about NFP is that once you understand your charting, and then the doctors tell you like, oh, you need to get blood work at post peak 7, you understand what that means, and you're getting your blood work done the day you're supposed to get it done. And that's just one example,
Sure.
But if somebody says that to somebody who's not charting, they're like, what do you mean post peak 7? I don't know what that means. But most doctors won't even say that. They'll just send you any time of the month that you can get in, and then the results are going to be skewed, because they're not going to be looking exactly for what they need to look for at that particular moment of the month. And so that's why I think it's so important.
Right. So what do you two see as maybe some of the challenges of using natural family planning, and maybe some of the blessings?
That's where more of our story comes in, because we haven't really touched upon that yet, is just that we haven't had children yet. But I would say that the blessing of NFP is, one, we knew when I was fertile. We were able to communicate about that. And then there were a couple times in this year and in this past year where I've had to be on an antibiotic treatment for the endometriosis. And so then we had to practice NFP because we were afraid of getting pregnant, and then maybe there was being something wrong with the child because of so many antibiotics that were going in my body. So we already knew what it was to chart. We didn't have to just start charting like 8 months into our marriage, because I had already been doing it. And so it was a blessing. We're like, okay, Andy, now we really got to practice NFP and abstain for these 3 weeks or whatever. And then I just had surgery for endometriosis with a NAPRO technology surgeon. And we had to wait 2 months before hopefully trying again to conceive. And so we had the charts, and I'm still charting. And so it was easy to identify when we were fertile.
Yeah, just to go back to your previous question, I think that when we were working with our Juliet's OBGYN to try to figure out why we were having difficulty conceiving, it was very helpful to have the records of Juliet's cycles going back, months and years, because she had all that documented, so we could provide that to the doctor, and that extra information was really helpful in diagnosing or ruling out certain diagnoses. And so that's, I think, another benefit of charting, is that it helps you have that data that your doctors and your medical team can use to figure out if you're having a problem with your reproductive system. I think the challenges and the blessings are kind of one and the same, because I think one of the challenges is that you have to practice self-denial. and you can't treat sex as self gratification or as mutual gratification, but you always have to keep in mind that that our sexuality is part of a higher plan that God has ordained, and that God has made us so that uniting as husband and wife is also the thing that brings new life into the world, and that's an incredibly beautiful thing. It's a beautiful part of our Catholic faith, but it's also a cross that you have to carry, because there are times when you have to say, we can't do what we have the urge to do on this particular day, and so it's difficult, but it's also it's very beautiful, and it adds it doesn't add, but it reveals the spiritual depth in sexuality, and it's a beautiful thing.
Yeah. So you talked about having difficulties conceiving, and that that's definitely challenging. So have you seen a growth in your spiritual lives? Or and also are there any resources that you've used, like support groups or talking, sharing with other couples when it comes to that?
Do you want me to go?
You can go first.
Okay. It's been difficult, and it has for sure helped me to grow in trust of God the Father, and knowing that He has the best plan, and we don't, basically, and we would have loved to have kids right away, and it's been now 13 months or so, but for sure, like, Jesus, I trust in you. Jesus, best. I have faith that God is all good, and so whatever He gives us is going to be good, and I trust that the surgery and NFP can help us, but I also know that sometimes God doesn't give us what we want, and I have to be a realist, because we don't get everything we want, and God has a bigger plan. And so right now I'm like, it could happen, it could not happen, but I want to grow in gratitude every day for what we have, for who we are, and just take it one day at a time. And then maybe in a year or two, if we don't have kids, then discern what is God calling us to in either ministry or an adoption or fostering, which we're not thinking of yet because it's still pretty early. But it's like, okay, God, one day at a time, and Jesus, I trust in you.
Yeah, that does take a lot of trust. That's beautiful. If only all couples could see the benefit and the beauty, that's wonderful. Juliet, I think about, all of those years that you suffered, with the pain of, your menstrual cycle. And I imagine that, took a toll, physically as well as mentally.
Yes.
But have you experienced or seen any connections between using natural family planning and your mental wellness and health?
I think it's helped me identify that it's okay that I feel a certain way during certain times of the month.
Sure.
So, like, if I start to feel more emotional, and I'm already emotional as it is as a woman, but even more during certain times of the month, like, I'll understand, okay, this is the day I'm on, this is what I know is going to happen. And once again, that awareness is so important, I think. And so it helps me just kind of tell myself this is normal, or it's okay that you're starting to feel maybe more anxious about some things, or whatever it may be. So I think once again, that awareness is helpful for me. And like I said, and then also now being married and charting, sometimes it also is difficult mentally, knowing, wait, but I was fertile and we tried, and why didn't we get pregnant? because now we do know the answers in a way, or we do have the charts to prove that it should be happening. But ultimately, that helped us get to our diagnosis. So,
right.
And as she said as well, like it is difficult, or at least it was difficult during our first year of marriage when we would try to get pregnant, and then we would hope that this was the month that it was going to happen, and then she got her period, and just it's helped me grow as a husband to help comfort her and reassure her during those difficult moments, and help her bear that burden.
Right.
And I would say also, mentally speaking, how has this helped is I can tell him, like, Andy, right now I feel like I'm PMSing. So just so you know, I might lose my patience, or I might say something and I'm sorry, but just so you know, this is where I'm at and this is how I'm feeling, and I'll tell him, and you're usually very understanding of it and accepting.
Right. So, in what other ways do you feel like, having learned about your fertility as a couple, your shared fertility, how has that maybe impacted or overflowed into other areas of your marriage? Obviously, it's impacted how you deal with your physical health, but any other areas?
Well, I think it's helped us grow closer and made our relationship more intimate, because it's another area of our lives that we are regularly having conversations about, regularly sharing together, as opposed to the woman's cycle being the woman's concern, or the woman's kind of responsibility to take care of. It's something that we are mindful of and approaching as a couple, and so I feel like that has helped us grow closer together.
Yeah, absolutely. We wouldn't be sitting here right now if it wasn't for NFP. So in that way, I think it's helped us grow, like, in another area where, like, I want to talk about this. It's very important to me, and like, if a young couple were to ask us something, I think we could share so much more now, as a married couple, to someone who wants information. So I think, like, even in that area, and I was a teacher for 10 years before going to the crisis pregnancy center. So we love teaching and we love learning. And so I think it's just helped us grow in knowledge. And now, like Andy said, we want to keep learning about more things when it comes to eating and health and children and everything that comes with that. So I think even just, like, intellectually, it's helped us to grow together as a couple.
So I want to touch on the pregnancy center, but then I also want to ask this, because you just kind of mentioned it. What would you recommend to other young women and engaged couples regarding learning about their fertility?
I would say that women are probably going to have to do their own research, because from our experience in pre-Cana, it doesn't seem like it's really talked about that much. And maybe, unfortunately, the priests don't have enough information about it. So it's not going to be handed to them. They really have to do their own research. And there is a lot out there on social media. There's this podcast, and there are good and, like, practicing Catholics talking about it on social media, but you have to seek that out. So I would say to women to seek it out and to watch those videos and read that literature with their fiance.
So, Juliett, you work at a pregnancy center. Are you able to speak with married women about their fertility and introduce natural family planning to them?
At JMJ Pregnancy Center, we do present NFP as an alternative to contraception to women that are engaged or married. And so if a woman comes in for a proof of positivity, or even in a crisis situation where she's contemplating abortion, and she's engaged or married, we do tell her about NFP. We tell her why it's so much better than putting chemicals in your body, or even using contraception. And so, yes, we do present her with information and we talk about it. And hopefully in the near future, we're going to be able to start classes there as well.
Mm-hmm. Oh, wonderful. Wonderful. So, when did you look into NAPRO as a solution to your fertility struggles?
So Andy and I looked into NAPRO, I think about like 5 or 6 months into marriage, because since I had been charting and my primary care doctor already had so much data on where I was with my cycles, she said, you should get pregnant within the first 4 months. She's like, optimal health says it would only take 4 months, especially if you know when your peak day is and everything. And so when that didn't happen, I saw my doctor and she said, okay, let's try the antibiotic therapy. And that didn't work. So then it was probably more like 6 or 7 months then into marriage when she said, I know a NAPRO surgeon, Dr. Lamoot in Plant City. You should make an appointment with him. And so in about March, we made an appointment with Dr. Carlos Lamoot, who I'm also so grateful for. It's about an hour and a half from where we live. But to me, NFP and NAPRO are worth it. Even if you have to drive 2 or 3 hours, I think we would do it. Mm-hmm. And so he was able to look at my charts and at the blood work that my primary care had done according to my charts, and said, yes, we think it's endometriosis. He wanted to take us and have us try letrozole therapy, but we chose not to do that yet, and we haven't done it even after the surgery yet, because there was enough underlying issues that we thought surgery would be best to get to the root problem of what I had, which even involved a blocked fallopian tube. So I also had that. My left fallopian tube was blocked, and he had me go through various exams before the surgery to figure out, okay, what are we going to do at surgery? Which is one of the reasons why I think NAPRO technology is so important, is because they'll try to eliminate and get to the root and not just go to surgery, right? And so before the surgery, he realized that my left fallopian tube was blocked. And he said, I'll try to open it during surgery, but if I can't, I'm going to have to remove it. Because if not, I had a very high chance of an ectopic pregnancy, which we did not want to go through. And so he tried to open it. This was just in August, so very recently, and he couldn't. And so he had to remove it. But I can still get pregnant with one fallopian tube. And to me, I'm actually more at peace knowing that I don't have that great chance of having an ectopic pregnancy. And so for all the women and men out there, please look for a NAPRO technologist. It's the way to go, and so much better for the woman and ultimately the couple.
Sure. You're getting to the root of the problem.
Absolutely. Yeah.
So Andy, how was all of this for you? Was this difficult?
It's been yes and no. As I said earlier, I feel like we encountered a problem, and the problem has a solution that most of the time is effective, and so I'm very hopeful that we will be able to become parents if that's in God's plan. But it has been very difficult to. It's been very hard on Juliett, and the desire that she has to be a mother, and just to have to find out every month that we are still not getting pregnant has been very difficult for her, and so that's been a difficulty that we've had to work through and struggle through together.
Yeah, absolutely.
I also want to say we were able to get the surgery only a few months after seeing the surgeon, because we had those charts, because he could see the data, which is once again another benefit of NFP, is you can provide your doctor so much information He didn't have to start from scratch. My PCP, who is also NFP trained, knew when to do the blood work. So a surgeon didn't have to start from scratch on that. And so I had to say that that's another huge benefit of having all of that done prior to seeing the surgeon.
What a blessing.
Absolutely.
I think so many couples wait and struggle for so long before they start looking for, solutions. So
yeah.
Thank goodness you guys were really proactive, very proactive.
I would say that's definitely my personality is like, if I don't advocate for myself, for my family, no one else is going to. And so that's why I said about women, when they're engaged, they need to go and do that research, because no one's, unless it's like you or somebody from your podcast, no one's going to be giving them that information, because sadly people don't know it. And so you have to go and say, I'm going to take care of myself and look for the right information and good information. You have to advocate for yourself.
Right. Yeah.
And I also would say that I, felt a bit of urgency as well, just because, for both of us, we're kind of late to the marriage game. I'm 38, Juliet's 36. So we, I'm like, we're 2 years apart. Yeah. So, I just kind of felt like, we don't have a lot of time to waste. We would like to start a family, and it's not going to get any easier for us to have children the older we get. And so my thinking was, if there's an issue with our fertility that's treatable, we should identify it and diagnose it and get it, take steps to address it sooner rather than later, rather than waiting and then finding out that the opportunity has passed us by. So
yeah, that was actually also a huge thing that I forgot we spoke about multiple times during this whole year, is like, do we wait? Do we try to process this a little bit faster? And you kept saying, why don't we just keep going forward because of our age, and why not? So that's
exactly true. Yeah. And you knew you wanted a family, and time's ticking. So thank you, Andy and Juliett, for being on the PeakDay podcast. I appreciate it so much. You're opening your lives and your hearts for us on the podcast.
Absolutely.
You're welcome. It's great to talk with you.
Yes. Thank you for having us.
Thank you. Thank you.